come in, come in, come in. It's so good to see you. Please have a seat. Yes, yep, me too. Fist pump. Yeah, you look really well. I heard that you passed the physical part of your medical exam for government work with flying colors, and I have the results right here. And you did absolutely fantastic with flying colors. And I have more good news. We just have to do a quick neurological exam to go along with the physical exam. And you, my friend, will be ready for full government employment. Now, you have some extensive medical records here. I'll have to ask you a few questions, but otherwise, I think we've got a simple little procedure we've got to do. Just a very, very simple procedure. And the first part of that procedure, I know that government has to do everything the right way, or oh my goodness, you never hear the end of it. That just boggles the mind, doesn't it, sometimes? Bureaucracy. Can be such a pain in the ass. But we all have to do it. We all have to go through it. So here we go. And we're just going to do it really quick. Cranial nerve exam, and it won't take long, and then we'll just mark you right off as complete and done. So I guess the first thing, is there any former medical conditions that you would like to tell me that you haven't disclosed here? Because I have pretty complete records for you, but is there anything else that you'd like to add to it? Okay. When was that? Back in 2012? So you had a parasitic worm stuck in your, in your brain. Oh, not like you didn't have like a warble on your skin. You actually had a parasitic worm in your brain, and it ate some of your tissue out of your brain before it died. Okay. Well, that's something you might want to add to your medical records. Let me write that down. That's that's a good one. This didn't come up in the pre-question medical form when they were vetting you? Okay. You didn't feel the need to disclose it at the time. Okay. Okay. And you're sure it was dead? Like it's gone? So, I mean, okay, it was 2012, so I'm sure if it was still in your head, that would be pretty bad. Okay, is there anything else that might turn up in a neurological exam that you'd like to disclose here? Oh, you had mercury poisoning. You were actually diagnosed with mercury poisoning. Oh, and where did you get exposed to that level of mercury? From eating tuna. Oh, okay. Okay, all right. Wow, you ate a lot of tuna. Okay, so you have a memory fog, memory loss from a brain parasitic worm, and also neurological damage, you think, from mercury poisoning. Okay. All right. Well, you know what? You are a perfect specimen, perfect physical specimen of adult male, the male body at your age, height, weight, perfect. I know I could learn a lot from you on that regard. So, just looking at that, I think, you've been very accomplished in your life, so we're just going to let that go for right now, and let's just focus on the test, because yeah. I don't think it has to be too extensive. I was not thinking it would need to be too extensive, but there are some steps. I'd like to just check a few things. So, first off, I'd like you to see if you could maybe smell something properly. See if this damage to your this worm damage in your brain, if it had anything to do with if it affected your senses, like sense of smell. So here's the first one we're going to try. Okay, see if you can smell that. Smell that? Okay. Good. All right. And you know what it is? That's right. Lavender. Very good. So, yeah, I had some nerve damage on my face too. You can see that my eyes aren't symmetrical anymore, and so we've all had, if you live long enough, you're going to have something happen, something's going to take you out, Yeah. But, yeah, you got kind of the double whammy there, though, with the mercury poisoning and the parasitic worm. I wonder if the mercury killed the worm. Whew, you dodged a bullet there. Maybe that's what happened. You never know, but I'm glad that it didn't eat a lot of tissue, just enough that you had memory loss, and yeah, would be an indicator that maybe you lost some substantial amount of, yeah. And let's just see, can you smell that? Okay, all right, yeah, that's right. And what do you smell? That's right, garlic. So we'll just do one more here. So this one's pretty easy. You should get this one pretty easy. What do you think that smells like? That's right. Vanilla. Vanilla. Just like, Grandma's cookies. Making some cupcakes in the other room. Yep. Let me see. Ooh, I like that smell myself. Yes, that's quite intriguing. So, how much memory loss did you have? Do you remember that in particular? Like, did you feel like the memories came back, or did you find that you were, like, I'm just curious for my own. I was just gonna write something down here. I mean, nothing that's gonna affect the test, but just gonna write a few things down here, since it smells great. So, but yeah, you're doing good. So the next part of the test is visual fields and acuity. So we're just gonna just check a few things here. I'll hold some fingers up here, and can you tell me which ones when you can stop seeing this one? Okay, and then when you can stop seeing this one. Okay, and then real quick, how many do I wiggle in here? Okay, how many am I wiggling? So, how many am I holding up here? Which? Yep. How many back here? Good. And here? Good. Too much of that. So we know you can see. And then, just real quick, we're just gonna look in here. Ooh, yeah. Ooh, yeah. Okay, let me see. All right. Yep, your eyes are looking really good. You're doing great. Yes, you are. And then, real quick, I'm just gonna hold this right here, this little thing, and we'll wiggle it. And you tell me when you can't see it. Look straight at my face here. Right? Okay. And you can see it there. Okay. There you go. Alright, and then, good. Good. And, right, good. You're doing great. Now, this next part, we're just going to, it's a little invasive, it's a little scary maybe. We're just going to sweep in there, and we're just going to look and see if how your eyes react. Follow it. So follow it. Just follow the little red dot. That's right, just follow the little red dot. There you go, you're doing really good. Just follow the little red dot. Doing good. That's all we want to see. Just want to see how your eyes follow the little red dot. You're doing so good. Just follow the little red dot. Follow that little red dot. Good. You're doing so good. Really proud of you. Just follow that little red dot. You're doing so good. Good. All right. Now, I'm thinking, what memories did you lose? How would you know if you lost memories? Because you wouldn't know you lost them because you don't remember. So what memories did you lose that you knew you were losing? Somebody had to tell you, I guess. Okay, that makes sense. Yeah, I'd want to forget that too. So, all right, just hold still. We're just going to get a little baseline reading here. Let's see, I had some. Yeah, just breathe normal. Yeah, you're doing good. Just breathe normal. Okay, then we're going to reach around the behind you here and just check your lungs. Take a deep breath in and exhale. Deep breath in and exhale. Okay, now the other side. Deep breath in. Okay, exhale. And deep breath in and exhale. Okay, really good. I'd like to, if you would, I'd like to just press on your neck here. Get your pulse. Taking your pulse. Okay. So hold still. Yeah. Okay. All right, and are you feeling any brain fog from the mercury poisoning or the memory loss? Do you feel any brain fog? Nothing more than normal, yeah. Well, I mean, if I was addicted to heroin for, 10 years or more, I would think you would have a little brain fog once in a while, and a little couple of pinballs bouncing around in there, like bing, 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 yeah, against the mercury, floating around in there. So, yeah, no judgment, no judgment. So, we're just going to check some facial strength tests. So, could you, let me just lift your eyebrows up? There you go. Push them down. Push them up. And then, could we get you to just, and blow out your cheeks, just like that. Just feel your lymph glands, your neck. Very good. There you go. And can you shrug your shoulders and turn your head side to side, up and down. There you go. Doing great. You're doing great. Okay. Now, once more. How many fingers am I holding up? Good. And let me know when you stop seeing this finger. Okay. And the same thing over here. How many fingers? And one finger. Just tell me when you quit seeing it moving away. Good. All right. And just look at me again. Okay, now what I want you to do is I want to take my finger. I'm going to put it like here, different places. And I want you to reach out. I want you to take your finger from your nose and to the tip of my finger, okay? But look at me. Yeah, okay, ready? Okay. Touch your nose. Touch my finger. Touch nose. Touch finger. Okay. Nose. Touch finger. Nose. Touch finger. Okay. Nose. Touch finger. Same thing on this side. Nose. Touch finger. Okay. Right. Okay. Ready? Do it again. Okay. Do it again. All right. And again. Okay. And again. And one more. And then back to the other side. One more. Okay. All right. Okay. Now, the next thing I'd like to do is, this is not sharp. It's not sharp at all. To just check and see if you feel it very lightly on your skin. So, do you feel that? Feel that? Feel that? Feel that? Good. Just like that. Good. You're doing great. So you feel that? Feel that? Good. Both sides of your face. Good. Feel that? Feel that? Good. Both sides of your face. Good. Alright, now the next thing is a little more invasive. It's basic. Some of it I'm going to do it against my own skin, you know. But we're going to check you for reflexes. So may I have your arm and let it go floppy. Let me take the weight. And just check your reflexes. So first the elbow and then very simple. Okay. And then your wrist. Okay. And we'll just have your other arm there. Nice and floppy. Let me take the weight. Okay. And then just check your elbow here. Okay. Now, while we're there, I'd like to see your hands. If you hand me your hands. And we're just checking your fingers. Let me know if you feel any pain while I'm checking the joints in the wrist and the fingers. Any pain? Good. No? Okay. So what we're going to do is we're going to check down to your legs. So if you just sit there and roll up your pant leg, roll up your other pant leg, and we're going to check your knee, and we're going to check your ankle. So first your knee, still. So let me take the leg, just nice and floppy, relax. Good. Good. Alright. And we're going to check your ankle. So just hold still. Good. And the other knee. So let me go ahead and take the weight. Thank you very much. You're doing really well. And we'll check the knee. Once more. Good. And the ankle. Ready? So let me take the weight. Good. Good. Alright. Now, if you just sit still, I just want to check your skin. Reactivity of your skin to touch. And how it works with just little pinches. Little friendly pinches on your skin. So I'm just going to lower your dressing gown and just check across your chest. There you go. I'm just going to raise your dressing gown back up. There you go. Very good. And we're just going to give me your hands again. I'd like you to take your hands and as I push down and I push up. Now I'm going to take a piece of paper here and I'm going to hold it between your fingers like this. See if you can pull it out. Just like that. And your other hand. Good. Good. Wonderful job. Very good. So I'm just gonna, you did really good. So I'm just going to write down a couple things here real quick. How do you feel? Well, it's always nervous when you're starting a new career and new job. I see you have a law degree. Do you have any kind of career in medicine? No. No background in medicine, just law. Well, most lawyers are failed doctors, am I right? No problem. So you're doing great. Don't worry about that. So just checking some boxes off here. You're doing good. Okay, we just want to check your hearing a little bit and your taste. So we'll just check your hearing real quick. Just gonna really simple. Really simple. Okay, close your eyes. Okay, and with your eyes closed, tell me if you hear this. Do you hear that? Just like that. Hear that? Good. Hear that? call it out. Good. Okay, now tell me when you hear this. Yep. Just call it out, point. Good, you're doing a good job. Okay, I think your hearing's just fine for a man of your age. You've done very well for yourself, protecting your hearing over the years, I can tell. So now we're just gonna do a real quick sense of taste here. We've got some little green taster bottles here. I like to mix them up because sometimes they dilute a little bit, and we're just gonna give you a little squirt here on your tongue. Okay. Tell me if you can taste that. What's that taste like? Right on the tip of your tongue. Very good. And we'll get another bottle here. And I'm just gonna give you a little taste there. Tip of your tongue. What does that taste like? Very good. So the first one you say was bubblegum. Very good. And the second one was... That's right. Yeah. The second one was tomato. Very good. So we just have to get one more for a good baseline. Shake it up a little bit. It's a very tasty. The bubble gum is very, like, people love that. So just a little tiny taste. Tip of your tongue. Okay. And what's that taste like? That's right, it has like an aspirin acidic taste, so very good. And I want to do just one more. The bubblegum really represented sweets, but I want to see how you react to this one. So, just very curious. Yeah, very curious if you can tell what this is. Okay, what's that smell like? What's that taste like? Very good. Sweet lemonade. Very good. You did absolutely fantastic on that test. Okay, so got that out of the way. Hearing and taste. Reflex. Now, just real quick, I know you have some problems with your voice, and I know that's, I don't want you to feel obligated to do too much, but I just want to see what you can do with your tongue, so stick your tongue out, roll it, okay, very good, and let me take a look inside there, say, look up, look down, side, to the other side, good, yep, good, your tongue looks great. Okay, real quick, I want you to look at me again. Look me right in the eye. Good, check your eyes again. Just look right at me. Look right at me. Just keep looking right at me. Checking dilation. Making sure they're both reactive. They both match. That's very important. Same thing over here. Okay, you're doing great. Reactive. Dilate. Reactive. Keep looking right at me. Just keep looking right at me. You're doing really good. Okay. Alright, we're just going to take a really quick culture now on your mouth. This is something for the government. We're going to take a little scrub there for DNA. It's nothing to do with the test. This is just something we need. Okay, and we're going to have to put that in its container. And send that to the lab, and that pretty much wraps up that part of the test. You just write down a few things here. So, you did really well. Let's see here. Yeah, I don't see anything. Physically, you're absolutely in the best shape of your life. Blood work is perfect. You're really ahead of the game there, and your neurological test came back fine. You have basic things like now I just want to ask you a few questions. Do you know what year it is? Okay. Do you know who is the current president of the United States? Okay. And do you know what today's date is? Yes. Okay. All right. And yeah, good. And do you know what city you're in right now? Okay. All right. And let me ask you one more question. What job are you applying for? Because it's always important to have that. What? You mean for the office of health and safety? Like, what are you going to be like you going to be like a lawyer for them? You're going to be the secretary. You're going to be the secretary of the United States Department of Health and Human Services. You. Oh, no. No, no no judgment. But you don't have a medical degree. You're a lawyer. You're a good lawyer. Yes, I know you have an environmental safety background, but you're not a doctor. Oh, you've written some books on vaccines and Dr. Fauci. Okay, well, yeah, that doesn't make you a medical doctor. It also doesn't make you an expert on anything. You are a law student, and I think you studied history and English before law. That's your bachelor. They're putting you in charge of it all, everything. Yeah, you. I really think you're neurologically. You're probably, you're fine. You're fine. I didn't see anything jump right out at me. You've got some, you, yeah. Well, yeah, that's important. We definitely need somebody in there to shake up this. You do know you had to take this physical, right? You have this anti-science mentality, but you had to pass your physical exam to get the job we're giving you. So you do know that we are testing you for employment with the government, and if you can't have the job if you don't pass. So, which I'm willing to pass you, but I'm trying to figure out if you have something, because you have to take this physical to get the job. Well, I know that everybody thinks you don't have to obey the rules here in 2025, but you do know that there's procedures. We all have to do it. It's not like I have to do it and you don't, or you have to and I don't. But yeah, I know the test's not gonna. Are you sure you're up for this? Like, well, I mean, the anti-science, the anti-vax, you like swimming in dirty water out with your grandkids. You had a dead worm in your head and you mercury poisoning, and you're not a doctor, but you think you can direct the whole entire 350 million people that live in this country towards a better and safer. Yeah. Okay. Well, yeah. I don't know if you know this, but that whole thing with Fauci was with the guy who's appointing you now. So he thought he was okay then, but you don't. Okay. Well, yeah. Well, I don't know what to say. At this point, I'm just gonna, yeah, you passed. I really don't give a, I really don't, I'm beyond giving up. I don't give a fuck. I don't. I really don't. If you want to be, you can be whatever you want to be. Yeah, you want to be a doctor. You want to tell people what they can and can't do. You want to, you want to tell people what to do, what to take, what not to take. You want to tell people to ignore their doctors and ignore medical advice. That's great. I'm glad. Yeah, I'm glad they got you doing this because no, I'm done. I'm passing you. You passed. You're a spring chicken. Yeah, you're perfect. I give up. I mean, there's like I don't know how many thousands of qualified medical people out there that could do this job, but we got a anti-science, anti-vac, brain damaged, crippled cocksucker doing it. That's fine. I'm willing to go with it. Hey, you're the man. Like, go for it. Like, I hope you do I think you're going to do great. I really think I really don't care. I really don't. I know everybody thinks I do, but I don't. I don't care. So, you have at it and have a good one. And here's the paperwork you need to, dismantle what's left of our good nation here. I'm going to fold this up real nice and tight so that you can cram the results of this test right up your ass. Yeah, there you go. I'm happy. Yeah. Well, it was really good to meet you too. Oh yeah. So fist bump. Yeah. You really haven't heard a word I said this whole time, have you? Not a damn thing to come out of my mouth. You didn't hear a word of it, did you? You just like that that little mannequin it's not a mannequin, he's a little puppet, like right over your head. Just you didn't hear a thing I said, did you? Okay. Well, you just that's right, break a leg. Yeah. Okay. Well, it's really nice meeting you, and there's the door. So I'm probably going to retire now. I think I'm just going to quit because I have seen it all. I've seen it all. Can't surprise me anymore. Just can't do it. Yeah. So, yeah. You have a good day. You too. God bless you. My child, yeah. Oh my God, I'm done. Okay. So, well, we're done. We ain't gonna make it. We ain't gonna make it. It was a good run. Well lasted. But, there's all good things have to come to an end. I mean, Rome fell. So, who the hell are we? So, just another footnote in history, I guess. Well, that's good. I'm glad we got that test out of the way. And, wow, I feel like I'm, gosh darn, part of history there. So, yep. Secretary of Health, it's my ass. We ain't gonna make it.